You're listening to Cyber 94 Podcast. If you want to break into cybersecurity with real-life experience, go to cyber94.com.
We're diving headfirst into a digital nightmare today, Chloe. The numbers from the first half of 2025 are in, and they paint a terrifying picture for anyone who has ever been a patient.
Wow.
More than 29 million individuals had their private healthcare data breached.
29 million. Ben, that's almost the entire population of Texas. And we're not talking about, leaked email addresses from a shopping website.
Right.
We're talking about the absolute core of your identity, the secrets you only tell your doctor.
Precisely. And what's really chilling is that every single one of the top 10 largest breaches was the result of a hacking incident.
Every single one?
Yeah. The days of a lost laptop being the biggest worry are long gone. This is targeted, it's malicious, and it's on a scale we've never seen. Let's start with the largest one, Yale New Haven Health System.
The name alone inspires trust, right? But then in March, they found an unauthorized third party just lurking in their IT systems.
Right?
The final count? 5.5 million people compromised.
The intruder copied a treasure trove of data, names, addresses, birth dates, and the holy grail for identity thieves, Social Security numbers.
Oh, wow.
The health system was quick to state that their core electronic medical records weren't touched, but, the damage was already done.
That's a small mercy, but it feels like saying a burglar stole everything in your house except the kitchen sink.
Exactly.
For 5.5 million people, their identity is now a commodity, just ready to be bought and sold by criminals.
And it's not just the hospitals themselves that are the weak link. The second largest breach affecting 5.4 million people came from a company called Episource. They're an IT vendor that handles medical coding for health plans and providers.
That's the part that truly terrifies me. You might have perfect trust in your doctor's office, but you have no control over the security of their third-party partners. A ransomware attack hits a company you've never even heard of, and suddenly a criminal has your name, address, health insurance data, your medical record number.
Yeah.
It's a breach by proxy.
But not every cyber nightmare involves a shadowy hacker in a dark room. Take the case of Blue Shield of California. This one is almost more unsettling.
Really?
Well, 4.7 million members had their data exposed, and not by a criminal, but by a simple website misconfiguration.
How does that even happen on such a massive scale?
Well, they were using Google Analytics to track how members use their website, which is pretty standard, but it was configured in a way that allowed it to share protected member data with Google Ads.
No.
Blue Shield insists Google didn't misuse the info, but the fact that it was shared at all, that constitutes a breach. It's the digital equivalent of leaving the filing cabinet unlocked and wide open on the street.
It feels so much more invasive, somehow. The idea that your private health concerns could be fed into an advertising algorithm.
Yeah.
It's a violation of a different, more modern kind.
And then we swing right back to the classic horror story. DaVita, a massive kidney care company.
Okay.
They were hit by the Interlock ransomware group, and this wasn't just a data theft. The attackers actually encrypted parts of their network.
Okay, this is where it crosses the line from a data privacy crisis to a public health emergency. DaVita runs over 2,600 dialysis centers.
Wow.
When their network goes down, patient care is directly impacted. The article even notes another ransomware attack on Frederick Health in Maryland caused a patient surge at a neighboring hospital because they had to divert people.
Right.
These attacks have real-world physical consequences.
Absolutely. The Frederick Health attack shut down their IT systems, and what did the attackers make off with? Patient names, social security numbers, driver's license numbers, and detailed clinical information.
Oh my God.
It's the complete package.
The list just keeps going. Anne Arundel Dermatology, $1.9 million. Radiology Associates of Richmond, $1.4 million. It's a relentless, cascading failure across the entire industry. You see a dermatologist, you get an x-ray, you have an insurance plan.
Right.
Each one is a potential entry point for criminals.
You're so right. The report on Community Health Center in Connecticut is particularly chilling. They said a skilled criminal hacker entered their systems.
Ah,
That phrasing gives me goosebumps. This isn't a random glitch. It's a deliberate, calculated hunt for our most vulnerable information.
and they know exactly what they're hunting for. Your diagnosis, your test results, your treatments. This information is a weapon.
It is.
It can be used for blackmail, for sophisticated fraud, for anything a criminal mind can imagine. This is the new reality of healthcare, a constant, invisible war being waged over our data.
It truly is. We put our trust and our very lives in the hands of these healthcare organizations, but they are locked in a battle against adversaries who are sophisticated, ruthless, and seemingly always one step ahead.
Now, here's a question we'd like you to think about. Knowing how interconnected and vulnerable our healthcare data is, does the convenience of digital health records still outweigh the terrifying risk of exposure?